Diabetes. Diabetes is a long-term medical disorder that affects how your body uses glucose, a form of sugar that is essential for your cells to function as an energy source. The pancreas secretes the hormone insulin, which is primarily in charge of controlling blood sugar levels. Elevated blood sugar levels are a result of problems with insulin synthesis, use, or both in diabetes. Diabetes comes in various forms, the most prevalent of which are Type 1 diabetes. This kind of diabetes is an autoimmune condition in which the immune system unintentionally targets and kills the pancreatic beta cells that produce insulin. People with type 1 diabetes consequently produce very little or no insulin. Usually, type 1 diabetes strikes in childhood or adolescent. To control their blood sugar, people with this kind of diabetes need to utilize an insulin pump or receive daily insulin injections. Kind 2 diabetes. The most prevalent kind of diabetes, type 2 diabetes, is defined by insulin resistance, or the cell's ineffective response to insulin. Additionally, the pancreas may generate less insulin over time. Obesity, poor food, and inactivity are lifestyle variables that are frequently linked to this kind of diabetes. Depending on the severity, management may include insulin injections, oral medicines, or lifestyle modifications. Gestational diabetes. A woman develops gestational diabetes when her body is unable to create enough insulin to fulfill her growing need for glucose during her pregnancy. Although type 2 diabetes is more likely to strike women with gestational diabetes in later life, it typically goes away after childbirth. One rare type of diabetes is called monogenic diabetes, and it is brought on by a single gene mutation. It usually manifests early in life and is heritable. Misdiagnoses of type 1 or type 2 diabetes are common. Depending on the precise genetic mutation involved, different treatments may be used. Secondary diabetes. This kind of diabetes is brought on by another illness or medical condition, such as hormone imbalances, certain drugs, or pancreatic ailments. Other specialized varieties. There are a number of other specialized varieties of diabetes, such as drug-induced diabetes, exocrine pancreas illnesses, including pancreatitis, and hereditary syndromes. In order to avoid consequences such as renal disease, nerve damage, cardiovascular disease, and eye issues, diabetes must be properly managed. Every type of diabetes has a different management strategy, so it's critical that people with diabetes collaborate closely with medical professionals to create a customized treatment plan that includes controlling blood sugar levels, leading a healthy lifestyle, and, in certain situations, taking insulin or medications. How to manage diabetes. Keeping blood sugar levels within a specified range is part of managing diabetes in order to avoid issues that can arise in the short and long term. Depending on the type of diabetes, type 1, type 2, gestational, etc., and personal circumstances, the precise management strategy may change, but the following general guidelines can help you manage diabetes effectively. Medical advice. To begin with, seek advice from a member of your healthcare team, such as a nutritionist, diabetes educator, endocrinologist, or primary care physician. They can assist you in developing a customized diabetes care strategy. Blood sugar monitoring. Use a blood glucose meter or continuous glucose monitoring device to regularly check your blood sugar levels. Share these readings with your healthcare team and maintain a record of them. Making educated decisions about the treatment of your diabetes is facilitated by monitoring. Healthy eating. Adhere to a personalized, well-balanced diet plan with an emphasis on limiting your intake of carbohydrates. Select lean proteins, healthy fats, complex carbs, and high-fiber foods. Limit your serving sizes to prevent overindulging. Refined carbs and sugar should be avoided. Physical activity. Maintain a regular exercise schedule to help reduce blood sugar and increase insulin sensitivity. As advised by your physician, try to get in at least 150 minutes of moderate intensity activity each week. Insulin and medication. If prescribed, take insulin or drugs as your doctor instructs. Learn the possible negative effects of each medicine as well as how it works. Handling stress. Stress has an impact on blood sugar levels. Engage in stress reduction practices including yoga, meditation, deep breathing, and relaxing hobbies. Frequent checkups. See your healthcare team for routine checkups to evaluate how well you weight control. If you have type 2 diabetes and are overweight, you can better control your blood sugar by reducing your weight by combining exercise and a nutritious diet. Seek advice from a dietitian or healthcare professional for a customized weight management strategy. Limit alcohol consumption. If you decide to use alcohol, Make sure you know how it affects your blood sugar levels and only consume it in moderation. Sufficient sleep. Make sure you receive enough good sleep, as insufficient sleep might interfere with the control of blood sugar. Foot care. As diabetics are more likely to experience foot troubles, it is important to regularly examine your feet for cuts, sores, and other problems. Management of blood pressure and cholesterol. Maintain appropriate levels of both blood pressure and cholesterol, since unchecked hypertension and high cholesterol raise the risk of complications from diabetes. Education. Since knowledge is a crucial instrument for effective control, keep up your education about diabetes care. Support and community. To stay motivated and on track, think about joining support groups or asking for help from family and friends. Plan your emergency response. Be prepared with actions to take in the event of a hypoglycemic, low blood sugar, or hyperglycemic, high blood sugar, emergency. Keep in mind that managing diabetes is very customized, so what suits one person may not be appropriate for another. In order to make the required modifications to your diabetes treatment plan as needed, regular communication with your healthcare team is vital. Effective diabetes treatment can lower your risk of problems and help you live a healthy, meaningful life, but it's a lifetime commitment. Sincere thanks to all of my viewers. Please share this video with your loved ones and friends. Please like and subscribe, so that they can see more video like this. Thanks for watching.